Hello everybody. These focus days, I hope everyone is healthy. Today I will present my last project in prep school. My last project is about my department. My department is physiotherapy and rehabilitation. Today I am going to talk about mirror therapy and atlas therapy. These are subtopics of sports physiotherapy. First, I want to explain mirror therapy. In this therapy method, a physiotherapist uses a mirror for a treat a patient, like this. For instance, if one person has a problem in his arm or her arm, patient uses solid arm in front of a mirror. He or she is supposed to imagine the mirror, his or she's solid arm. In this way, patient feels more comfortable psychological. This treatment method focuses psychology. I learned psychology is the very effective point in treatments. After that, I am going to talk about atlas treatment. Atlas treatments focus on muscles and bones, unlike mirror therapy. There are a lot of treatment methods for athletes, but I will explain only 3 of them. The first of these points is diagnosis. Because physiotherapists misdiagnose, treatments cannot be done. Physiotherapists ask questions to athletes for the treatments. In addition to this, the diagnosis of the patient is made in more detail using new generation device. Another way in the information control and promotion to recovery. These 2 techniques are affect each other. Because of this reason, generally physiotherapists use together these treatments. These treatments are used to reduce pain. So the athletes need to work carefully at this method. The last treatment method is to restore her or his agile body. If athletes want to have her healthy body, athletes should do exercise. When everything is taken into consideration, there are several ways to treat athletes. The physiotherapist should use right way. Now I want to show some YouTube video sections and pictures. These are my reference. When I researched these subtopics, these videos and pictures helped me. Thanks for your attention.
Stuart, please will you describe your job?
My job title is Lead Education and Development Physio. So I work with our under 14s down to our under 9s. I do a lot more education around injuries, what's normal for footballers to experience if they're training, what's abnormal, what do they need to report to us. There's no such thing as a typical day. Right, we're going to have a look at this lad who is 12 years old, who's coming with a little bit of a sore knee here. So he's going to go out and train, but there's a few things that we can do to make training a little bit more comfortable for him. As your body grows, your bones are a little bit softer. With the boys that we see around your age, it tends to be more knees. What we do is put some tape across the middle, which gives it another point to spread the load out. And this is dead easy. So we're just going to put the tape across the front of his knee, with a bit of tension through.
How important is your role at Man City?
It's vital if we're trying to build players for the future that their foundations are solid. If we don't get it right at this age, then it's likely that they might not maximise their potential as they get older. Teaching them how to be independent so they can take responsibility for themselves, have a bit of education around if they are injured, what are the best things they can do to manage that injury, I think is really important.
Place your hand on the residual limb while raising it upwards. The residual limb is now pressing upwards and you press against it with your hand. When I check here, I can tell that Ferrodon is applying counter pressure. You can hold this exercise for up to 30 seconds. Now you can lower your residual limb, then position your hand on the other side. Now you press the residual limb outwards and press inwards against it with your hand. It's very important that the hand is not placed too close to the end of the residual limb, because the end of the bone could press into the soft tissue and cause you pain. The same applies when moving downwards. The residual limb is pressed downwards and you press your hand upwards against it. Very good. And the last direction of movement is inwards. Position your hand on the inner side, push your residual limb towards the other leg and press outward against it. Exactly. Now lower your residual.